Hello, my name is Jan Leifman.
Hi, I'm Gayatri Pramal.
Welcome to MedNews Week Conference, where we feature presentations by medicine's global leaders. Today we have an amazing keynote speaker in Dr. Aaron Glatt. Dr. Glatt is the chair in the Department of Medicine, the chief of Infectious Diseases and hospital epidemiologist at the Icahn School of Medicine at Mount Sinai South Nassau.
In today's presentation, Dr. Glatt discusses the most recent developments in COVID-19.
Did you know that Dr. Glatt is also the spokesperson for the Infectious Disease Society of America? He's also the recipient of the 2020 New York American College of Physicians Laureate Award and also named a Master of the American College of Physicians.
A true pioneer indeed in the field of infectious diseases.
So let's tune in and learn from this global leader.
You could react and immediately address any issues that come up. There are rare, and I stress rare, neurological complications that you can get from vaccination. And if somebody did have such a complication, that would be a reason not to give any additional vaccine doses of that particular type. And then there are some specific complications that could potentially recur in people that either had them prior to their vaccination or got it from a first dose of vaccination. So therefore, these are all things that a physician needs to discuss with the patient before they get vaccinated, but these are very rare, and if you don't have any of these medical contraindications, then you can get vaccinated. The one other situation where we recommend delaying vaccination is in people who've gotten the monoclonal therapy to treat acute new onset COVID, or in some situations, people that got the monoclonal antibody infusions to prevent them from getting COVID after a very serious exposure. So here, the monoclonal antibodies stick around for a certain period of time, and it would be potential that you wouldn't develop an immune response to a vaccine if you gave them the vaccine within the next 90 days. And it's likewise unlikely that you'll get COVID in the next 90 days after having had a monoclonal antibody infusion. So therefore, we usually recommend waiting 90 days. That's not hard and fast, and it's not clear that 90 days is the appropriate amount of time either. Therefore, people that did get monoclonal antibody need to be aware that vaccination may not be as effective for them in the period of time after they get their infusion therapy. And finally, somebody who recently had COVID. So there are no clear-cut guidelines as to when they can get vaccinated or when they can get a booster. And I used to recommend that people wait 90 days after having had COVID before they go and get vaccinated. However, with Omicron, this new strain that we're currently in the midst of this pandemic, where right now in the United States and across the world, it's unclear whether that still remains an appropriate strategy. Because if people had Delta a month and a half ago, they still could get Omicron right now, which was unusual. We almost never saw anybody that got a second episode of COVID within 90 days of their first episode of COVID. But this short list here are basically the only people that should be considered maybe not to get vaccinated. Just about everybody else should get vaccinated. And there are different types of COVID-19 vaccines, 3 of which are authorized in the United States. We have the 2 mRNA vaccines, one from Pfizer and BioNTech, and then we have the Moderna. These are what people calling novel types of vaccines, but we've been studying them and working on them since the first SARS outbreak in 2002. And therefore, we have a decent amount of experience already with these mRNA vaccines, albeit they are for the first time now being used in human beings. However, we have almost 2 years of experience already with these vaccines and billions of doses, and have shown how safe and effective these vaccines are. And I'll go through some slides showing you that specifically. Then in the United States, you have the Johnson & Johnson, somewhat more standardized type of a vaccine that we've been familiar with, very similar to other vaccines. And across the world, you have different vaccines. You have the AstraZeneca vaccine that has been available in parts of Europe and in other places. And then you have vaccines that were developed in Russia, in China, and in India, which we have much less experience with and knowledge about here in the United States. They're not as well published on, but most of those vaccines are effective as well. But we'll focus really here tonight on the mRNA vaccines and the Johnson & Johnson vaccine. So how good are these different vaccines? What is their efficacy? Do they really do what they're supposed to do? So everybody loves to tell you, who doesn't love vaccines, that you can get breakthrough infections and therefore the vaccines aren't good. Or maybe they were once good, but now since we have breakthrough infection, the vaccines are no longer effective. So I'm here to tell you tonight that breakthrough infections do occur. I will try to keep my talk as evidence-based, as factual, as data-driven as possible, and not put in my own thoughts or comments, except when I tell you I'm doing so. Vaccinated people can get infected with COVID despite the fact that they've been vaccinated. And this is especially true with Omicron, which is so highly contagious. And yes, if you do in fact get infected with a breakthrough infection, meaning even though you're vaccinated, you got infected, you could transmit it to other people. However, if that's the only fact you know, you're really missing out on the big picture, because the bottom line is people who are vaccinated, what we call fully vaccinated, meaning they got 2 doses of the mRNA vaccines or they got a single dose of the Johnson & Johnson vaccine, are much less likely still to get severe illness. And when you give the booster dose, the 3rd dose of the mRNA vaccines, or a 2nd dose after the 1st dose of the J&J, and that could be either with another J&J or with an mRNA vaccine as your, quote, booster dose in that situation, and we'll talk more about what boosters mean a little bit later in the talk, so then you are much less likely to die. Now, the benefit and the purpose of a vaccine is to prevent serious illness and to prevent death. And these vaccines do that phenomenally well. We see almost no one who has been boosted getting seriously ill, getting into the hospital, requiring intubation, requiring ICU care, and heaven forbid, dying. The only exceptions to that rule are people that probably had such severe immune compromise, meaning their immune system was so broken because of either some therapies that they were getting, because they got a transplant and were taking all sorts of immunosuppressive drugs. Only that small group of patients, they're essentially not vaccinated, even though they got 3 shots, because the vaccine can't create immunity in them. But almost all other people, these vaccines work superbly to prevent serious illness. Yes, you may get a slight cold. You may get some asymptomatic infection and test positive. You may have a flu-like syndrome. You may even be a little bit sicker than that. But the vast majority of the boosted people will not require hospitalization. They will not get very sick, and they certainly will not die. In the United States right now, the people that are dying, people that are getting very, very sick, are almost all unvaccinated. And this has become a pandemic right now of the unvaccinated. And clearly, the best way to prevent spread of COVID-19 and to prevent creation of other variant strains is by getting as many people as possible vaccinated. Those are the facts. And I ask people, where should you be getting your information from? Now, a lot of people go on the internet, and the internet can do wonderful things for people, but it can do horrible things for people as well. And the internet is not filtered. The internet doesn't have peer review on most of it. The internet is something that you cannot guarantee the accuracy of things that you read on the internet. And therefore, I tell people, whether you like Dr. Fauci or not, whether you like the CDC or not, whether you like major pillars of science, those are the places where you can get, in general, unbiased, accurate data and information. Now, it's not 100% true. Everybody's human. But at the same time, the vast majority of documented, published things on these websites, such as websites like the Infectious Disease Society of America, like the American College of Physicians, like the local departments of health, the New York State Department of Health, the CDC, the FDA, the NIH. These are 99.9% going to be wonderfully accurate, excellent sources of information. And you'll in fact see slight discrepancies between them. But they're all written and put together by different groups of scientists. And yet they're uncannily similar in their content and in what they truly recommend, because they're all pulling from the same evidence-based medicine. And it's peer-reviewed. It's peer-reviewed by Republicans and Democrats. People have no political connection. It's peer-reviewed by scientists that come from across the gamut of the United States, from all different political views, from all different ethnic backgrounds, from all different races and colors. And therefore, the information that you'll find on these unbiased websites is going to be by far the most accurate information that you can get. And that's important for people to realize. If you just Google COVID, you'll come up with numerous inaccuracies. If you really want to go and find out what's going on, go to authorized, appropriate websites. And they will show you how efficacious these vaccines are, as I've just told you, and how safe they are. We all want to make sure that we don't put something into our body that's going to hurt us. So how do we know that these vaccines are safe? Because they've gone through a process, a tried and time-tested process, which was not cut or shortened to develop these vaccines. It just went through it more rapidly than usual because of the seriousness of this epidemic and because of the need to get everybody together. Many things that normally would delay this process were preempted, and everybody worked together, industry, science, the FDA. So the design of these studies was perfect from day one, and it didn't have to be repeated. It didn't have to be modified. And the funding for this was supported by the government. So therefore, companies were willing to take risks that they otherwise would not have taken from a fiduciary perspective for their clients and for their stockholders. So therefore, when the FDA finally granted full approval to the Pfizer vaccine a half a year ago, back in August of 2021, you can guarantee that as good as anything in science, this was safe. And the FDA acting commissioner at that time, Dr. Janet Woodcock, stated that the public can be very confident that this vaccine meets the high standards for safety, effectiveness, and manufacturing quality that the FDA requires of an approved product. There were no shortcuts. There were no corners that were cut. Everything went through the normal process, and things have continued to be sped up so we can get these products available into people's arms as fast as possible to save lives. Now, they're not perfect. The vaccines are very, very good, but they're not perfect. And they do give you a lot of mild side effects around the time of the vaccination. That's normal, and it's very common. Majority of people will get some sort of a reaction. Local reactions are extremely common. You get some soreness at the site, you may get some swelling, you're going to feel achy and weak possibly, you may get a headache, you may get a flu-like syndrome. Probably more than half of the people will get such a reaction. It usually is mild, it usually goes away within 24 to 48 hours. And a whole bunch of people don't get it. And a small percentage of people get it a little bit more severe. But these are more than acceptable side effects considering the great benefits of these vaccines. Obviously, there are rare cases of more serious side effects. And let's focus on the mRNA vaccines, the Pfizer and Moderna vaccines, because that's what the majority of vaccine usage in the country is at this time. So there is that rare anaphylactic reaction. That's a severe allergic reaction. It occurs 5 in 1 million people. Now, those 5 people, they don't die. They're usually taken care of, and they get a reaction. They're taken care of, and then they have the benefit of being vaccinated, although nobody wants to have an anaphylactic reaction. It can be a serious and scary reaction. But to put that in context, flu shots have almost the same rate, 1 to 2 per million people. So it looks like it's a lot more, but you're dealing with 2 or 3 people per million to get this reaction, more so than with a flu shot. And that's a more than acceptable risk to take when you're dealing with a life-threatening infection like COVID-19. There have been reported cases of myocarditis, that's an inflammation of the heart, or the membranes that surround the heart, of myopericarditis. This is seen more in men under the age of 30. There have been cases of this, yes, but none of them, to my knowledge, have resulted in death. And most of them are self-limited, which means they go away in a short period of time and they don't cause any permanent sequelae. They don't cause permanent heart problems, as opposed to COVID-19, which does cause severe heart disease in and of itself. So you have to weigh the chances of getting something with a vaccine versus the chances of getting something just from the disease itself. And that's the same thing with the J&J complication of some of the blood clots that have been associated with it, some of the thrombotic events that have been associated with the J&J vaccine. You have to realize that those events are actually more common in COVID. So there's no such thing as a free lunch. Vaccines have side effects. They have mild side effects, and they have some rare serious side effects. But you need to be aware of the risks of COVID and weigh that. Everything in medicine is a risk-benefit analysis. You take Tylenol, you take aspirin, you take Advil, Aleve. All of these have reactions. All of these have risks associated with them. And you have to weigh, is the risk-benefit ratio worthwhile? And I tell you, without these masks, without these vaccines, we'd be all wearing different designer masks, because without vaccines, we'd be really pretty much left to distancing, masking, and other types of avoidance strategies rather than dealing directly with COVID-19. There's been tremendous concern expressed, and if you read the internet, you'd think that this is factual, about the vaccine not being safe. The question is it safe in pregnant nursing women, women trying to get pregnant, people with underlying medical conditions, and people who've had COVID-19 or have had antibodies? Are they able to take the vaccine? Should they take the vaccine? And these are very important questions. But again, science has answered all of these questions. And I want to stress why pregnant women, even if they didn't get vaccinated before their pregnancy, which ideally they should get vaccinated even while they're pregnant. And this is just one of many studies that are now available that was published in a very prestigious journal, JAMA, which looked at healthy women versus women with COVID. And the women who had COVID, nothing to do with the vaccine, they had COVID during the pregnancy, were far more likely to die, get intubated, and get serious illness and have to be admitted to an intensive care unit than if they didn't have COVID. So COVID is a major illness in young pregnant women. And if you could prevent that, look at these numbers here, 5.8 more times likely to be admitted to an intensive care unit, COVID versus non-COVID. 14.3 more likely to be intubated, have a tube put down to breathe for you if you're pregnant and have COVID versus you're pregnant and don't have COVID. And this is the scariest one. We don't expect pregnant women to die. The mortality rate in the United States for pregnant women is extremely low. You have 15 times more likely to die when you're pregnant if you have COVID than if you don't have COVID. Likewise, there's a higher risk for preterm birth, to give birth early with all of the complications that entails. Likewise, there are studies to suggest that there's a higher rate of miscarriage. All of this underscores the importance of having everybody vaccinated, preferably before they're pregnant, but not to be concerned that they need to get vaccinated during pregnancy, because the vaccine is safe in pregnancy. There's been ongoing monitoring and follow-up, and there's been no pregnancy-related problems from the vaccine. There's no increased incidence of miscarriage. There are no additional adverse effects in pregnancy in vaccinated women versus non-vaccinated women. And there are hundreds of thousands of women that have been followed for this. And the data, hard data, do not find any safety concerns for pregnant women who are vaccinated, either in themselves or in their babies. So this is critically important. What about women that are nursing? So again, you actually may have a benefit. The same thing was true for pregnancy. I'll say it now, for pregnancy as well as for nursing mothers. They may be passing along protective antibody to their babies. The mother goes through the placenta to the baby inside of her, and when the mother's nursing to the baby once the baby is born, so there are antibodies. If the mother has been vaccinated, there are antibodies that pass through from the mom to the baby inside of her or to the baby that she's nursing, which actually may protect the babies. Now, we don't know how much protection that provides, but in the laboratory, we can detect that protection, and certainly it's thought to be important. Again, there is no evidence at all that these vaccines can cause infection or side effects in women that are nursing their babies. And finally, women want to get pregnant. They're concerned that this vaccine will somehow make them infertile because that's what it says on the internet. And that is simply false. There is zero evidence, none, not even a little bit, to suggest that these vaccines in any way cause infertility in men or women. So this is critically important for people to understand. And the concerns that people have appropriately is, will this vaccine hurt me or my ability to have children, is a valid concern. But the data show that that's not a concern. And I will tell you that if a person gets COVID and they die, they're certainly never going to get pregnant again. And if a person gets COVID and it has significant impact on their health, and they have heart problems, and they have long COVID, they have fatigue, they have tiredness, and it can persist for years. We have people that got COVID back in March of 20 that are still sick from COVID. So those people are certainly going to impact their fertility, and it's certainly going to impact their ability to be parents. So therefore, taking the vaccine before, during, or after pregnancy is not something that women should be concerned about. Those are the absolute facts, the best that we know them. Everybody remembers the toilet paper shortage. And here's an underground area where people are trying to hide from COVID. And did anybody remember to bring the food? So let's talk about, has Omicron changed our vaccination priority? Everything that I said was true, certainly, when we had the initial variants of COVID-19, when we had the Alpha variant, then we had the Delta variant, other variants in between. And the question is, how much, if any, has Omicron changed the picture? And does our vaccination strategy no longer work, or does it need to be modified because of Omicron? So the answer is Omicron has changed everything, and it may be for the better. There's some things that are obviously of great concern to us right now as we're in the midst of Omicron, but there's the potential that Omicron actually might be a silver lining, and that it may have benefits in terms of getting herd immunity and getting potentially towards the end of this pandemic. So let's understand what Omicron does. Is it more infectious? And the answer is yes. It is more infectious than Delta, which was more infectious than Alpha, which is more infectious than the original strains. So yes, Omicron is going to spread like wildfire. And this is going to occur even in vaccinated people. Vaccines prevent serious illness, not necessarily mild or asymptomatic infection. So that's important to understand. Therefore, to state that, well, look how many people are getting infected even though they're vaccinated, that's true, but it doesn't tell you the picture, the whole picture, because look how many of them are getting seriously ill. And the answer is very, very few. So yes, Omicron is much more infectious. It is probably less severe. So that's fantastic news. And that we are seeing, for the same numbers of patients in the hospital, much less usage of the ICU, much less intubation, less usage of oxygen, and certainly less deaths. Since there is so much Omicron, we still have higher numbers in those categories, unfortunately. But per cases, per 1,000 cases, per million cases, Omicron is less severe and causes less serious illness. That's very important to remember. In addition, it probably has a shorter duration of illness, which impacts our isolation requirements or recommendations. So Delta probably has an average of people getting infected somewhere between 5 and 6 days. So that's an average. Some people get infected a little bit earlier. Some people will be infected a little bit later. Whereas Omicron normally causes illness probably on day 3 after the exposure, if not even day 2. And most of the illness is going to be shorter. So when somebody is exposed to Omicron, in the first 48 hours before they get symptoms, they're highly contagious, and they don't know it because they're perfectly well. And then they're probably contagious for the next 72 hours once symptoms start. So it's a more compact period of time. And that's led to some of the changes in the isolation and quarantine recommendations for people that have either had COVID-19 with an Omicron strain or have been exposed to that. Now, almost all COVID-19 in the United States right now is Omicron. It has rapidly, very rapidly overtaken Delta because it's so much more contagious that Delta doesn't have any place to, so to say, fit in anymore, because every time Delta were to meet up with somebody, they've already been infected with Omicron or they've been vaccinated, and therefore Delta doesn't really get off the ground anymore. So that's important to understand. And as I mentioned, we're seeing more hospitalizations. Now, some of that is true hospitalizations because of COVID-19, but some of that is what I call incidental COVID hospitalization. That is people coming in to give birth and they test positive. People coming in to a pediatric ward because of some pediatric illness and they test positive. People coming into a behavioral health unit, a psych unit, and they test positive. They're not there because of COVID, but those numbers artificially are elevating the hospitalization rate. Now, that's not to say that it's not accurate that there are more hospitalizations now, but not all of them are because of COVID. Some of them are hospitalizations with incidental COVID. But having said that, we are seeing significant numbers of patients who require critical care, and we are seeing occasional deaths. Now, as I mentioned, these are almost always, certainly in the very, very seriously ill patients, the ones who require intubation, and certainly the ones that require, unfortunately, die. So these are often in the unvaccinated. They're almost never in the boosted patients. So now let's move on to the last part of the talk. And I put this little cartoon up there. Nobody's at fault for COVID-19, but we all have to take responsibility for our actions. And that is the big question: who needs to get booster shots nowadays? So there's two types of booster shots. There's the booster shots for people that weren't able to mount a good immune response. Those are people that have had a transplant, a solid organ transplant, a bone marrow transplant, and their immune system isn't working well. And we probably erred in only giving those people 2 doses of the vaccine. We probably should have given them 3 doses of the vaccine right up front. And it's clear that those people will benefit from a 3rd dose. It's even possible that they'll need a 4th dose. Those are a very specific group of people with moderate to severe immunocompromise, either because of therapies that we're giving them, diseases that they have, or because of immune modulating treatments that they're undergoing because of transplant therapy. So these patients are significantly immunocompromised, and they should be concerned, and they should go about their lives as if they were unvaccinated in terms of staying away from other people to a large extent and masking and distancing much more so than a healthier person. The second type of booster shot is the much more common shot, and that is that the vaccine's benefit does wane over time. And we're not sure what the optimal doses were. We're not sure what the optimal timing should be. And therefore, it's been clear, mostly from studies from Israel, that a 3rd dose of the mRNA vaccine, specifically in Israel, they only used the Pfizer vaccine, was very, very beneficial in protecting people from Delta from getting serious illness as well as from getting any illness from Delta. Now, again, Omicron is more contagious, so it's not going to prevent as much illness, but it will prevent serious illness. So it remains unclear what the optimal vaccination schedule should be. It's clear that you do need 3 shots for the mRNA vaccines. The question will be, will you need a 4th shot, a 5th shot? We don't know. And it's also a little bit unclear what the optimal time for the booster dose is. And we're currently recommending that you get your initial dose of the mRNA vaccine at time 0. You get another dose 3 to 4 weeks later, and you get another dose 5 to 6 months later. And that's the current recommendation. And most of this is based upon the Israeli experience. And we're going to have that additional experience from Israel where they're starting to give a 4th dose now to see how that impacts Omicron. So more to come on this. We'll know a lot more in the next month or 2. Finally, I want to conclude with the idea that you can take the COVID-19 vaccine with other vaccines such as flu. And we are seeing, again, a resurgence of flu. Last year, there was essentially no flu. The first time in recorded history that we had essentially 0 cases of flu because everybody was masking and distancing. And those practices will prevent not only COVID-19, but also will prevent the flu. So there was almost no flu last year, and we're seeing flu come back with a vengeance this year. And therefore, it is important and an imperative that people get vaccinated both against COVID-19 with a booster if they haven't, if they've already gotten their primary series. Obviously, if they didn't get the primary series, get the primary series, but also to get a flu shot. And that can be given on the same day. We recommend using different arm, but it can be given on the same day. So I want to conclude by thanking you for listening and realize this cartoon, I think, says an awful lot. It's amazing how many parents went from, I don't understand my kid's sixth grade math homework, to are now an infectious disease expert in just 6 months. And there's a lot of truth in this cartoon. There are many people that feel that just because they've read an article or two, even in a prestigious, good lay publication, that they're suddenly expert and entitled to an opinion. And I would dare say that people should really leave that to the experts. And the experts can be wrong, and the experts can change their mind based upon new science. I can't tell you how many times I've said what we did last week, last month, we now think is not correct. But at the same time, we're dealing with this pandemic with the best scientific evidence-based medicine approach that we possibly can. And those are the people that you really want to listen to, rather than somebody who really doesn't understand infectious diseases and public health, and for whatever emotional, political, or other reason that they have, make recommendations. So please listen to the pros